It is Thursday, the 28th of December, 2017, and you're listening to Skeptics with a K, the podcast for science, reason, and critical thinking. Skeptics with a K is a production of the Merseyside Skeptics Society, a non-profit organisation for the promotion of scientific skepticism on Merseyside, around the UK and internationally. I am your host, Mike Hall. With me today is nobody. Of course, it's Christmas time, which means the hosts of Skeptics with a K are scattered to the four winds, enjoying a little bit of time off over the festive period. But rather than leave you wanting, or indeed recording another drunk show, we took the time to record a little bit of bonus content, especially for you now. So I hope you enjoy it, and we'll see you in 2018. So I've spent most of the last year talking about placebo effects and how they're not all they're cracked up to be. Turns out this is a pretty big topic. Even though we've discussed it from several different angles over the last year, there's still many aspects that I've not been able to talk about in any depth. In particular, there's a paper on placebo effects in inflammatory skin conditions, which I'm still trying to get to grips with, and a fascinating effect caused by doctors exaggerating the condition of their patients in order to get them into a study. So the first thing which seems to happen is those patients improve even when they're on placebo, because it turns out their doctor has exaggerated their condition in the first place in order to meet the inclusion criteria.
Yeah. I suppose when you're looking at like clinical trials for something where someone's got something serious, it's like, well, we've not got a good treatment for you, but there is this trial that looks like it might be promising. So all we need to do is make you look like you're a bit sicker than you actually are
in order to get you into the trial.
Don't they do that on House? I'm sure they've done that on House.
They might have done it with the 13 character who had Huntington's.
No, I think it was a patient that they did it with. It was like, well, or maybe it was the other way, is that they used something to artificially shrink his tumour. Just like superficially shrink the tumour. So, the margins look good.
They may well have done. What Alice is thinking of is that when they put 13 onto a Huntington's clinical trial and fudge the randomization so she's in the active treatment group.
That was her boyfriend.
And then she gets quite cross, saying, you've completely fucked the result of this study now because you've screwed with the randomization. You learn a lot about epidemiology, like watching House. But in the meantime, I have built up a back catalogue of questions and articles which have been sent by listeners over the past year, suggestions for things that we might want to talk about on the show, many of which I'm only just getting to read. So this is a question that came in from Dan. Dan said, this study was just published in the Medical Journal of Australia claiming to prove that acupuncture is just as good as analgesia.
How just?
We'll come to that. I'm not savvy enough to point out the flaws in the study any more than this is just one study and hundreds more have shown the opposite kind of a way. Would you kindly tear it down? And I think I will kindly tear it down. I will tear it down in a very kind and polite way.
You tear it down kindly?
I will. I can do things kindly without effing and blinding. So Dan linked to a paper titled Acupuncture for Analgesia in the Emergency Department, a multi-center randomized equivalence and non-inferiority trial. This was published in the Medical Journal of Australia from the Australian Medical Association. 528 patients who presented at the emergency department, which is what we'd call accident and emergency, or in America they'd call the emergency room.
Yeah, and by presented they mean turned up rather than give a 45 minute
they rocked up. So
it wasn't like a massive ignite.
528 patients rocked up at the emergency department at 4 Australian hospitals and were randomised into 3. I'm not sure that rocked up. It's maybe an exaggeration to say they rocked up, limped up, hobbled up.
It depends on why they've gone to ER.
And, some of them...
Rock addiction.
Some of them certainly had sprained ankles, so they were definitely limping up.
Yeah.
I don't know, how does an injured Australian move? Is that...
I don't think it's ever happened.
No?
They grow up in such a harsh and treacherous environment, they just become impermeable. It's like the wombat's arse.
How's the what?
So the wombat has is this not right? It's not got like a very thick hide to its arse. So what it does is like it, when it's being attacked, it tries to like hide in a hole with its arse sticking out.
Oh, that sounds vaguely...
You can hoof it up the arse and it doesn't care because it's got a big, thick arse.
I mean, Sarah Clement, our good friend and wombat expert / obsessive, who will be in Australia when this show goes out, will doubtlessly get in touch, not just to tell us whether I'm right or wrong or mischaracterising it, but probably with extensive explanations of why not only is it a very good defence strategy, but also the most adorable and wonderful of defence strategies. But yeah, I'm sure they just have like very, very thick hides around the arse region.
So 528
Like an
patients.
Australian.
That's not a limp. This is a limp. 500.
That just sounds like a New Zealander showing off his lighting. That's not a limp.
Blue more limp. Well, a limp here. Yeah. 538 patients showed up at the emergency department with pain as a symptom.
Okay.
Patients were excluded if they had a temperature because they thought that might indicate an infection rather than just the need for a simple pain relief. They were excluded if they had already taken some pain medication before they came to the hospital.
Were they excluded if Mummy had already kissed it better?
No, they weren't, because that
Okay.
is only a placebo effect.
Oh,
so
okay,
it
gotcha,
counts. They were excluded if they had a skin condition because that might interfere with the acupuncture.
Joking aside, they were excluded if they went to hospital for pain and hadn't taken any painkillers. If they'd already taken painkillers.
Yes.
Is this just a study of morons then? It's like, oh yeah,
It depends on the pain, but yeah, you'd expect most people going to hospital for pain
Just
to
for
have
pain.
tried painkillers.
yeah, because
first.
it's not like I'm coming to hospital for pain because I've got an open wound on my hand and it's hurting. It's I've got a sprained ankle, it's hurting. I'm going to take some painkillers.
Well,
There are cases when I might consider going to hospital for pain without first trying painkillers, but that's if I know that I've dislocated something and need somebody to relocate it for me.
And you're not a normal person.
I'm not a normal person.
No, you are like you would be excluded from this trial for different reasons.
Also, bear in mind that there were 1,964 patients who turned up at the hospital, and only 528 of them made it through the inclusion criteria.
Yeah.
Because it was like, you've had a paracetamol, right? Fuck off then, mate.
Yeah.
And the three conditions that patients turned out to have...
Wait, that means 500 people went to hospital with pain and hadn't tried
and
a
hadn't
painkiller
taken
first.
any painkillers, no. Or at least not in the hours leading up to going directly to the hospital.
But if it's a sprained ankle, then maybe be like, oh God, this is a sprained ankle. This might be worse. This might be a ligament thing. I'm going to go straight to hospital because this could be a serious ligament thing.
Yeah. So it was bad back, sprained ankles, and migraines were the specific conditions that that the patients had.
You go to hospital for a migraine without taking
And
a
haven't
painkiller
taken it. Or they could, of course, be lying about
Unless you
it as
don't
well.
know it's a migraine. I went to hospital once with what I thought was a migraine, and turned out to be an eye ulcer. Because I was like, I can't be around any light. This isn't right. So I went to the doctor, and the doctor told me to go to the hospital.
Is this when you had like a needle put in your eye?
Yeah.
Yeah, you've told that story.
I think about this way too often. Because honestly, the thing that really worries me is that, like, what if you moved your eye while there's a needle in there?
Yeah, you have to stay really, really still.
No, but like that's not good enough for me. It's not like, oh well, don't. It isn't a good enough answer because I would.
But you have to stay really, really still.
No, but I wouldn't.
Because they can't do anything. Like, they can't give you a muscle relaxant because then they can't keep your eye open or the pupil dilated properly.
But
they
I
can't,
wouldn't be able to stay still.
Anaesthetize you or
that would make
anything.
me go blind. I'd be blind off the back of that because I wouldn't be. I can't keep.
You do have impulse control
She
problems,
did keep
Marsh.
telling me off. She did keep telling me off for moving my eye.
But like,
and she was like, I'm just going to do it quick before you move.
in your eye.
Yes. But you're the person who thinks, like, oh, I can't be near a baby in case I throw it out a window.
That's not impulse control problems. I've never thrown a baby out the window.
Well, that's because they don't go near babies just in case.
I've held babies. I probably
Not
held,
near
You
windows.
just don't go near the window.
I think it's excellent impulse control because I have that impulse and don't act on it. Whereas if you don't have that impulse, then you don't act on it. But it doesn't matter because you didn't have it in the first place. Of course, you didn't have the impulse.
Okay.
Is that a Christian thing? I do good because I'm worried about God. Well, that's not proper good. It's good to want to do bad.
So you think
that
the world
analogy fell down very quickly.
the world is a better place if everyone wants to throw babies out the window but doesn't?
Yeah, absolutely.
Okay.
Absolutely. Because otherwise you might actually drop a baby out of a window. Because you got to think, if you've got a baby in your hand, you're near a window, and you're always thinking, fuck, what if I throw the baby out the window? You're going to not drop that baby out of the window by mistake.
Do you think that's what Michael Jackson was doing? Just someone said, whoa, Michael, what are you doing? He goes, oh, shit. I hadn't thought about it, to be
Yeah, you
honest.
just didn't realise. If you've got a baby in your hand and you're near an open window and it does not cross your mind that the baby might fall out the window, you should not be handling babies around windows.
Different.
It's not. If the only thing that goes through your mind is throw the baby out the window, throw the baby out the window.
Or you could just be like, oh, I'm quite close to a window and my hands aren't very steady. Maybe I should just move away from the window.
Well,
You don't have to have the impulse to realise that it's not safe to have a baby near an open window.
But the impulse is your brain like sense checking stuff, because you don't have the impulse in isolation of throw the baby out the window. You don't even have that impulse. What impulse you do have is, oh God, I really shouldn't throw the baby out the window. You don't actually ever have the impulse of throwing the baby out the window. You just have the reaction impulse of don't throw the baby out the window. It's literally just your brain shouting at a part of your brain that isn't saying throw the baby out the window, shouting at it not to throw the baby out the window.
Okay.
Totally normal. Totally normal. Totally normal.
So, patients were excluded if they had a temperature. They were excluded if they'd taken pain meds. They were excluded if they had a skin condition, because they thought if you're giving acupuncture through a skin condition, you could push if it was a fungal infection or something, you're going to transcutaneously push the infection.
What if they had a skin condition in a different area?
It was specifically if you had a skin condition in the acupuncture-ish areas.
Which is anywhere apart from the cock.
That is true.
It's true.
And they were required to have a score of at least 4 on the VNRS measure. The VNRS score, I thought, was quite interesting. I thought, what is the VNRS score? This stands for Verbal Numeric Rating Scale, which is science for how much does it hurt.
Mm-hmm.
Okay.
1 to 10.
0 to 10.
It's hard because I'm immediately thinking, so self-reported, the study's bullshit. But no, it's because you're not talking about placebo this time necessarily.
No, I'm not, no. This is...
Well, you're talking about acupuncture,
but it is
so you are.
self-reported.
It is a standard self-reported outcome. How much pain are you in a scale of 0 to 10?
And more reasonable to use in things like pain.
Yeah,
because
absolutely.
Well, you've got no option.
Nothing else to
You've got
use.
no option in pain. So if the number you gave, if you turned up at the emergency department and they said, how much pain are you in? And you gave a number less than 4...
I hate this question.
You are excluded from the...
Whenever doctors
study.
ask me, what are you on a 1 to 10? I have no idea how to answer it.
Yeah, because they have this idea of 0 is no pain at all and 10 is the worst,
But
pain imaginably.
ever have no pain at all.
You're calibrated quite differently to other people, aren't you?
I live my daily life on at least a 6.
Where are your pains at the moment?
My ribs, my
Still.
shoulders, my lower back. My ankles were hurting on the way up here. No idea why.
Prime candidate for this study so far, Alissa. You're a 6 and ankle pain.
Have you taken any painkillers today?
No.
Oh, you're all right.
We're doing
Have you
all
got a
right.
skin condition?
No.
That's fine.
I mean, there's a bit of red on your upper arm you've been rubbing cream
I've been
into.
Scratching my arm for some reason.
I don't know if that's
I think that's more of
an
a nervous
acupuncture
tick
point.
than anything else.
So if you gave a number less than 4 on the pain scale, then you're excluded from the study. After all said and done, the patients were randomized into 3 groups. The first group was given acupuncture by a properly trained acupuncturist. The second group was given acupuncture plus some painkillers. Mm-hmm. And the third group was given just painkillers. The painkillers were at the discretion of the administering physician, as was the acupuncture.
So it might have been like paracetamol, ibuprofen, or it might have been prescription painkillers.
Could have been, yes. Yeah, it was treated as the administrative physician thought was appropriate. They described this as a pragmatic study, which is a thing in clinical trials. If you do, but did they
express that data, like what kind of painkillers people are on?
No, but I'll come to the kind of data.
But this is an American study, so it wasn't like it was heroin. Because America, it's all opioids. Straight away, bam, opioids.
I mean, there's still a lot of opioids that you'd be put on.
Well, this is an Australian study, so it's an Australian painkiller, which I think is Foster's.
We'll come to a little bit more
or
on
a bag
the painkillers later.
Or a Golden Gay Time. It's an ice cream. So
the first group acupuncture, second group acupuncture plus painkillers, third group was given just painkillers or pharmacotherapy, as the paper likes to refer to it. The researchers took a baseline pain score before the intervention, referred to as T0, and then they took a second pain score 1 hour after the intervention, which they refer to as T1. So at baseline T0, the mean pain score across all 3 groups was 8.5. So that's
a lot of pain.
Each group individually had an 8.5. So they're well-balanced groups by the sound of it. Mm-hmm. And given that researchers usually define 10 as the worst pain imaginable, 8.5 is quite a high pain.
I mean, that's quite a high.
They've just not got good enough imagination.
Yeah. They must have had a lot of people in there giving a 10.
Possibly so, yeah. Possibly so.
What did they do?
But then those are the people who've gone to hospital without taking a painkiller first.
Yeah.
They're the wimps.
And they've sprained their ankle.
They've sprained their ankle.
I've got a badly sprained ankle. This is a 10 out of 10 on the pins. I cannot imagine. I'm like, how about a second sprained ankle? 2 sprained ankles is going to be more pain. No? Okay.
So 8.5 was the baseline score across all 3 groups. By T1, pain scores had reduced in all 3 groups. 6.6 was the mean for the acupuncture group, 6.3 for acupuncture plus pharmacotherapy, and 6.5 for pharmacotherapy alone. Not a statistically significant difference. All 3 interventions appear to be just as effective as each other.
After the first hour.
So acupuncture equally effective to acupuncture plus painkiller. And painkiller alone.
And painkiller alone, yes. The paper concluded the effectiveness of acupuncture in providing acute analgesia was comparable to that of pharmacotherapy. Acupuncture is a safe and acceptable form of analgesia, but none of the examined therapies provided optimal acute analgesia. Because, to be honest, going from an 8 to a 6 is not fucking brilliant.
No, it's not. That seems a weird conclusion as well, that acupuncture worked rather than nothing really worked. I thought that's what the optimal thing was saying. Nothing really worked that
well.
Yeah, because in that space of time, the patients might have just got used to the pain.
That's true.
Or the pain might have gone away naturally.
Depending on what the pain was caused by, yeah.
We will be coming to all of these arguments.
These are classic things to look out for.
Will be getting made. So acupuncture is safe, acceptable, and just as effective as painkillers, says this paper, which rather flies in the face of much of the best acupuncture research, which shows that acupuncture is little more than an elaborate placebo. On the subject of placebos, you'll notice that there is not a placebo arm in this trial. This is sort of a problem and sort of not a problem. We're used to this idea of a placebo-controlled trial, but they're less common than you might think because doctors frequently don't care whether their new drug works better than nothing. They're interested in whether it works better than the existing standard treatment.
Yes, that makes sense, yeah.
So many new interventions are tested with standard therapy as the control rather than something inert. This study in particular was designed as a non-inferiority trial. That is to say, the aim of this study is not to prove that acupuncture has an effect. The aim of this study is to prove that acupuncture is not worse than pharmacotherapy.
That's a weird aim.
Which is a reasonable position to take for ethical reasons, if nothing else. Because when you've got a group of patients with a mean pain score of 8.5, giving them an inert intervention is just mean.
Yeah.
The lack of a placebo arm is not in and of itself a problem with this study. There is a problem that the best evidence for the efficacy of acupuncture says that it is actually an inert intervention, which means it is not appropriate to use in a non-inferiority trial. So that is something of an issue. But ethical issues with the trial design don't explain away the results of the trial. The trial showed that acupuncture had as great an analgesic effect as painkillers, and that's a result which needs explaining. So what were the problems with this study? First off, we have the blinding. From the paper, participants were not blinded to their treatment allocation. Single blinding was maintained by blinding assessors to treatment allocation and the acupuncturists to pharmacotherapy use. So the patients are not blind.
Well, they couldn't really be blind.
No, because you know when someone is sticking you with pins and you know when you're swallowing pills and you certainly know when you're doing both.
Yeah, but here's the thing that I've always been unsure about. Can you count it as blinding if they know they're getting acupuncture, but they don't know what they're being studied for?
It depends really on the trial and what effect the breaking of the blinding would have on the trial. Knowing that you're getting acupuncture for pain relief is going to modify the report of your pain relief. Irrespective of whether acupuncture is what your trial is studying or not, the fact that you know you're getting acupuncture is going to modify your biases.
Yeah.
Now, if you were doing a study in which that didn't actually make a difference to one of your outcome measures, then maybe. But in this case, it does make a difference to the outcome measure because they're studying pain.
Yeah, yeah.
So patients are not blinded. The acupuncturist was blinded. So the acupuncturist, when they were giving needle to the patients...
You really don't want to be blinded if you're sticking people in your
You don't really, do you?
Well, I think if you have an ulcer in your eye and you've got the needles, I think you can be blinded.
The acupuncturist did not know whether the patient they were sticking needles in was also getting painkillers. So the acupuncturist was blind as to the use of pharmacotherapy on their patients.
Is an acupuncturist who goes to put needles in a place and misses an inacupuncturist?
Inacupuncturist.
Inacupuncturist.
And you could do this study with double blinding if you introduce placebo pills and sham acupuncture. So everyone gets needles and pills, but one group gets fake pills, one group gets fake needles, or one group gets the real thing of both. But that isn't what they did for this study. It would also significantly complicate the trial design. So that isn't how this study was run. It was run as a single-blind study. Patients on acupuncture knew they were on acupuncture. Patients on painkillers knew they were on painkillers. Patients on both knew they were on both. And the primary outcome measure is the patient's own self-reported pain score, which is going to have been affected by exactly the same biases that I've spent the last year talking about in my placebo effect stories. It is entirely possible that the patients receiving acupuncture alone reported less pain because acute pain does tend to reduce over time. Or they're reporting being in less pain because they thought they should be because they'd received an intervention and they don't want to disappoint or argue with their physician, because you don't really want to argue with your doctor. Or it could be the fact that they are subjectively coping better with the same physiological pain because of reduced anxiety, or it could be that they're exaggerating how much pain they were in when they arrived at the hospital. And so at triage, they gave a pain score of 3 and a bit. And the same effect I was talking about earlier, the triage nurse went, 3 and a bit? Would you say it's a 4? Maybe even a 4? Because then I can put you in the fucking study. Especially if they're having to find people who haven't taken any painkillers, and out of 1,900 patients, they only managed to get 500 of them through the inclusion criteria. You could imagine the triage nurses going, "You sure it's a 3.5?"
There's also a question about the painkillers as well, because what counts as not having taken any painkillers? I've had this migraine since 10 o'clock this morning. I took 2 paracetamol at 10. It's now 8 p.m.
I think specifically they said within the last hour before they turned up at the emergency room. I think
only the last hour?
I think it was 60 minutes, but I didn't write it down.
So
I don't know.
When did you take the paracetamol? I think it was about, it might have been, 70 minutes ago? Would you say 70 or just say 60? You could get the same thing going on.
Sure. It could be the case that at T1 they misremember how bad their pain was at T0, so they think, well, I said 8 before, and it's less than that now, so it's a 6. But actually, you're not judging on the 0 to 10 scale. Yeah. You're judging against how well you remember your pain being last time, with the pain last time being the upper limit of how high you can go. So there are dozens of different effects which might mean that we see a change in pain scores without acupuncture having any specific effect. And we've talked about these kind of effects several times over the past year. But in placebo effect research, participants are often healthy people brought in and subjected to some painful stimulus. Their hands are locked in a vice, or their arms are burned with lasers or whatever, and they're fed placebos and asked again how they're feeling. And whatever is reported at that moment in time is recorded in the literature as the answer for all time. But the patients in this study are different because they are presenting with pain, and their pain is not being artificially administered by lasers and vices. Their pain represents a real underlying physiological issue, a migraine, a sprain, a bad back, whatever. So I have to wonder how much, if any, difference this is going to make to the result of the trial. Superficially, it might be similar because the primary outcome measures, we're looking at the difference between T0 and T1. But what about T2 and T3 and T4? In placebo effect research, the participants have taken their hand out of the vice and fucked off home by the time you get to T4.
Yes.
But these patients have got a real underlying cause for the pain, which isn't necessarily going to go away quickly. Buried in the discussion of this paper, I found a section which, when considered along the effects we've already described, might present a fuller picture of what is going on here. As discussed, the patients recorded a baseline score at T0 before receiving an intervention. They were asked then to reassess their pain score after 1 hour, which was labelled as T1. However, the protocol also provided for the patients at T1 to say to their doctor, "I'm still in a lot of pain, I need something more." At which point, the patients were given a second-line rescue intervention, which was usually morphine.
Wow.
And it turns out that when presenting at T1, twice as many acupuncture-only patients asked for the morphine compared to the patients getting pharmacotherapy.
Wow.
Fucking hell.
Or the combination acupuncture and pharmacotherapy. This was a statistically significant difference with a p-value of 0.016. So twice as many acupuncture-only patients asked for more pain relief compared to the patients who had received some painkillers, whether or not they'd received acupuncture or not. So although the acupuncture-only patients are reporting their pain score had reduced from an 8.5 to a 6.6, a similar change to the one seen in the other groups, the acupuncture-only patients were also the only ones asking for more pain relief. Not their only ones, but twice as likely.
Yeah, they were more,
to ask for more pain relief. Because it turns out the intervention that they had was not sufficient. Just as we'd seen in the asthma study where patients given fake inhalers reported an improvement even though lung function tests showed that there was none, the patients giving acupuncture in this trial reported a reduction in pain, but then went and asked for more pain meds.
Yeah. That's amazing.
Which indicates that perhaps the reported change in pain was driven by bias because they actually had a need for more pain relief. The authors try to explain this away in the discussion. They say, while pain reduction at T1 was similar for all three groups, patients in the acupuncture group were almost twice as likely to receive rescue analgesia. This may indicate that the acupuncture was ineffective and that patients sought alternative analgesia, or it could be that they were more likely to accept pharmacotherapy because they felt they had missed out on standard care.
Oh, good God.
So they're saying maybe more acupuncture patients asked for pain relief because acupuncture doesn't work, or maybe they were jealous that they hadn't got painkillers.
People hate taking painkillers. The number of people you talk to when they've got a headache, like, have you taken a painkiller? No. I don't like taking drugs. I don't like taking tablets. Why would I want to take a painkiller for my headache? Because you're complaining non-stop about a headache.
Yeah, I do that a lot.
Yeah, I don't take tablets. I'm useless.
Now, given that our best assessments of the primary literature on the efficacy of acupuncture shows that it doesn't fucking work, I'm more inclined to say the former explanation, the reason twice as many acupuncture patients were asking for more pain relief is because acupuncture doesn't work, is a better explanation than they were jelly, that other people had got morphine and they hadn't.
You'd think that it would be responsible of the researchers, the people who actually wrote the paper, to take that prior plausibility into account when they're laying out their two options as to why people might still want morphine when they've only had acupuncture.
Yeah.
You'd think they'd say, well, it could be this, it could be that they feel jealous, but given the fact that there's no evidence or even plausibility that acupuncture exists.
You'd have thought that, but the authors, for some reason, have decided to conclude the opposite. They've concluded that acupuncture is a safe and acceptable form of emergency analgesia. I say, for some reason, I've got an inkling as to what the reason might be.
Go on.
The lead author, Dr. Mark Cohen, who styles himself as Dr. Mark, because all Australian doctors do this doctor first name business. Dr. Mark Cohen is Professor of Complementary Medicine at RMIT University. He's a board member of the Australasian Integrative Medicine Association. Yep. He's Fellow of the Australian Medical Acupuncture Society, Chair of the Australasian Spa and Wellness Association, Fellow of the International College of Acupuncture and Electrotherapeutics Research. So I think it's fair to say he probably has a horse in the race. Skeptics with a K is a production of the Merseyside Skeptics Society. For more information, visit our website www.merseysideskeptics.org.uk or email podcast@merseysideskeptics.org.uk.